Let's talk about FiO2 and oxygen. Now, the actual definition of FiO2 is fraction of inspired oxygen. What this means is, of all the gases that we're currently breathing in right now, how much percent of it is actual oxygen? Now, for reference, the amount of oxygen that you and I are currently breathing in right now at regular sea level is about 21%. This means that of all the different gases that are in the atmosphere, like hydrogen, nitrogen, carbon dioxide, of all those amounts of gases, about 21% of all of that mixture is actual oxygen for us to breathe. Now, what does this mean for us as nurses? You're going to encounter a lot of different respiratory conditions where the patient is having a difficult time oxygenating themselves. And in these times where the patient is having a hard time oxygenating themselves, the first thing you're always going to probably do is slap on some oxygen onto the patient. When someone is on supplemental oxygen, you're usually going to hear the terminology, how many liters of oxygen is this patient on? So for different devices that deliver oxygen, a lot of the times it's delivered in liters per minute. Unless they're on a ventilator, in that case, you'll probably hear how much FiO2 is this patient on. Now, nasal cannula is usually the first line of oxygen supplementation that we'll be putting on patients. This is for patients that don't require too much oxygen, and the amount of oxygen it can deliver ranges between 1 liter per minute all the way up to 6 liters per minute. Now, if you remember, every 1 liter of oxygen equals about 4% increase in the FiO2 that we're breathing. So if you think about it, we're currently breathing 21% oxygen just on regular room air. A 4% increase would be about 25% oxygen if you add that 1 extra liter of oxygen. And if you continue adding the liters per oxygens and increasing the FiO2 with every liter of oxygen, you'll max out at 45% FiO2 once you hit that 6 liters per minute max of the nasal cannula. So nasal cannula gives you about 25 to 45% FiO2, depending on how many liters, either 1 liter of oxygen all the way up to 6 liters per minute. Next up, after nasal cannula, the next bump in oxygen supplementation is usually a simple face mask. These masks can deliver 5 liters per minute up to 10 liters per minute of oxygen, and that ends up equaling about 35% FiO2 all the way up to 60% FiO2. Up next, we have a partial non-rebreather, which is a pretty moderate, significant amount of supplemental oxygen that we're using here. This one ranges from 6 liters per minute all the way to 10 liters per minute, which, if you do the math, the FiO2 it gives you is approximately 40% FiO2 all the way up to 70% FiO2, which, like I said, is a pretty moderate amount of supplements. At this point, you're kind of starting to look at what might be going on if this person might be pretty sick. One of the last levels of supplemental oxygen that we can give is the non-rebreather mask. This is usually a pretty oh crap moment. I'm in trouble if they end up needing this supplemental oxygen, because this one is intended to give about 100% FiO2 if it's fully inflated all the way. If they're requiring that much oxygen, it's time to start considering other things like either invasive or non-invasive mechanical ventilation. 2 more supplemental devices we'll talk about are the high flow nasal cannula and the Venturi masks. We'll kind of just hit them really quick because they have a few other things to consider when determining how much oxygen you'll be getting. Starting with the high flow nasal cannula, this device is actually prescribed in 2 different parts. The first part being the flow rate and the second part being the FiO2. Now the flow rate, it goes all the way up to 60 liters per minute, and what this is pretty much the force behind the oxygen that's being delivered to you. So 60 liters per minute, that's a pretty high amount of force. A good way to think about this is if you were to stick your head out the car window while it's driving, don't actually do this, but if you were to do that, the rush of wind going up against your face would actually help push that air into your airways. Instead of you just sucking the air in, it's also pushing it in. So it helps get all that air into your airways, helping you oxygenate ultimately. So liters per minute is the first part. It goes all the way to 60 liters. The next part is FiO2. We've already been talking about that. The FiO2 with this device ranges between 21% all the way to 100%, which we know is the max amount of oxygen you can be given. The last device we'll talk about here is the Venturi mask. This device, a good way to think about it is pretty much it's a titratable mask. Depending on it comes with certain adapters that you connect and disconnect to it, and those adapters have prescriptions on it that tell you how much liters per minute to turn on in order to achieve a certain FiO2. So you have the mask. On that mask, you put a adapter. It comes with several adapters, and that adapter will tell you, hey, if you want to achieve 35% FiO2, you need to give this many liters per minute. If they need more oxygen than that, let's remove that adapter. Let's put the next adapter on, and that one will tell you, hey, this adapter is for 50% FiO2. If you want to achieve 50% FiO2, you need to crank up the liters per minute up to X amount of liters per minute. So this one is pretty much a oxygen mask that you can titrate the oxygen up or down on before moving on to either a non-rebreather if your needs exceed that of the Venturi mask. Which the capabilities of the Venturi masks, by the way, range between 2 liters per minute up to 15 liters per minute, which gives us approximately 24% FiO2 all the way up to 50% FiO2. And remember, we use these little adapters. That's why it only goes up to 50% FiO2, even though we're giving 15 liters per minute. And that pretty much sums up what we'll be talking about today. We hit the basics of FiO2 and touched base on some of the oxygen delivery devices. Of course, there's more, but that's all we'll be talking about for this video. If you found this video useful, please don't hesitate to share it to your friends, your nursing student friends, anyone that you might think would find this useful. Like the video, please. Follow for more. And yeah, hope you enjoyed the video and it helped you out. And we'll see you next time.